Hello, Yellow.
You are tuned in to the Chatty Cat Pawdcast, a podcast created to empower pet owners with information needed to better care for their pets. This Chatty Cat Podcast is sponsored by Doodles Cat Sanctuary, where every cat is worth fighting for.
Well, the first episode was really fun. We talked about a lot of things, mainly introductions. The second episode is really diving right into the meat and potatoes. Today's topic is responsibility of owners. Responsibility of owners. So one of the responsibilities of owners, and this relates to a dog and a cat that you both interacted with, and the kind of trials and tribulations they went through that came from the lack of neuter or spay.
Yes.
Correct? And so
very important.
And maybe that's a good topic to touch on. Really, the responsibility of an owner when you receive an animal or you have an animal, do you have to spay and neuter? Do you want to spay and neuter? Benefits? And there's probably, sounds like there's other options rather than spay and neuter, and I have a couple here listed. Looks like vasectomy or OSS. I'm not sure what those mean, so you'll have to explain those things. But maybe start on when you get an animal and it's not spayed or neutered, what should go through your mind, or what should you be thinking about? When do you get it done? Age, things like that.
Well, as soon as you adopt a pet, first thing you do is go to your vet and establish a good, healthy relationship with the veterinary services and discuss the plan for the first year plan. That is the most important part for a pet, first year, because it has all the vaccinations, it has deworming, it has surgery involved. Whether the dog is male, then we need neuter. If the dog is a female or a pet is a female, then we need a surgery called spay. Those very important surgeries that helps the health of a pet. But now recently there is two more surgeries are coming into play for a male dog. A vasectomy. Vasectomy means they will keep the testis intact, but they will tie the spermatic cord so that the dog will be unable to impregnate a female dog. So the dog keeps the hormones, and those hormones are healthy hormones for a dog's health. If you get neutered, the prostate cancer risk is gone.
Oh.
The main problem is if they are having male hormones running around in the bloodstream, the prostate hyperplasia happens. The prostate gland, which is covering the urethra, and those cells, they multiplied and they become bigger, and then they close the urethra. And then the dog in the later stage, it happens like more than 7 years of age of dog, and the dog cannot pee. So that can happen.
And that's a serious
That's
surgery.
a serious surgery. Now, what percentage of dogs who go through this? It is, I will say 1%.
Oh, that it happens to?
It happens to.
Okay.
If the dog is not surgically, if it is not surgery neuter done, so we have to weigh the benefit of having hormones, and you're keeping the testis intact, or versus removing the testis. The main thing why we want to remove it, the multiplication, the more
there's
babies are
uncontrollable.
So really, other than keeping the population control down.
Why would you say population control is kind of number one important reason? Why is population control for animals so important?
Because there are a lot of animals to be adopted in humane societies, in a rescue group, in other places. I used to work in a rescue group in New York for 6 months, and oh my God, I could not believe my eyes that how many dogs they're putting to sleep.
Right.
Daily?
Yeah.
Daily.
And cats?
Daily.
The
dog rescue.
New York City has a daily euthanasia list.
Yes.
And it's the average is like 15 cats and dogs a day.
A day?
And that's just one
place?
shelter in New York City.
Sometimes they wait for only a week or 10 days. Nobody came to adopt, then that's it.
Wow.
Or then they get sick while they're there.
They
That
get
happens
sick.
a lot too.
They
So
get sick too.
You had mentioned other options rather than the, let's see,
The neuter and spay.
Yeah, spay and neuter. There's a vasectomy or the OSS. Talk
Yes.
a little bit about benefits of those versus.
Yes, the benefit is these procedures will control the population.
Okay, so that takes care of the number one risk.
The number one risk is gone. They will not be able to increase the population of those animals, and but they will have ovaries and testes.
And that's a good thing?
That's a good thing for healthy for the body, but with the risk.
So the hormones bring risk at a later age
Later
where you
age.
may have other issues, but it's natural.
It's natural.
Okay. And OSS is
It's called ovary sparing surgery.
okay.
You
So,
spare the.
ovary sparing, okay.
so same thing that humans would get,
Yes.
basically.
Yes.
Okay.
Yes.
Does.
Right.
Yep.
Right.
Yep. All right. Well, Dr. Singh, you had an experience with a dog by the name of Princess.
Well, Princess came to the clinic and it was diagnosed for pyometra, pus in the uterus, because she was not spayed when she should have been spayed. And now she's 6 years old, and the family loves this dog but doesn't have $6,000-7,000 for the surgery. The hospital, they went to ask for $6,000-7,000 surgery. Then they contacted another clinic. That clinic was charging $300 to $500, $3,500,
$3,500.
and they didn't have that. They didn't have any money. So somehow they find out that we can help her. They came to us, and again I talked to Jen, and Jen said, sure, let us save another one. And so when we find out that there's a lot of pus in the uterus, we removed the uterus, and she came through the surgery. And it was a beautiful moment when I saw Princess meeting the mother.
So
Yeah,
you had mentioned pyrometra,
pyometra,
and that's a medical term for inflated uterus.
in pus in the uterus.
A pass.
Pus.
Oh, pus. Okay, so the pus is and it just fills up the uterus and it expands in the
Expand
body.
and yeah,
Probably damages other and eventually bursts,
it can burst.
and then that's
ended. Then you can't
the
save.
animal.
Is the only thing surgical is the only thing that can save them at that point?
Yes,
surgery is the
That's the
only
only
point.
option, right?
Wow.
That
It's not
can
like you
save.
can take an antibiotic or an anti-inflammatory and
If the infection just started first few days,
okay, but
then you
probably
can.
don't know.
But if
when-
it is 3-month, 4-month old
Right.
infection, and uterus has a tendency to expand. If there's a baby, uterus expand.
right,
Same way, whenever there's a pus, weight of the pus is so much, the uterus brain start thinking it's a pregnancy.
Oh, okay.
Wow.
So
Gotcha,
then the
okay.
muscles start getting relaxed and
Okay.
getting
Huh.
bigger and bigger and bigger, and pus start building up.
Now, pyometria is more common in dogs, or is it both?
More common in dogs than cat, yes.
Because I haven't heard of it in cats.
Yes.
Really, I don't.
I
hear
have
it that
seen
often,
pus
but-
pyometra in cats, but it is you're right. It is more common in dogs than in cat.
Okay.
So the way to prevent that would have been when they first got the dog, neutered or spayed.
Spayed her.
Yeah.
Then they would have prevented all that the dog has to go through.
Wow. Is it expensive to neuter or spay your animal?
No, it is very, very. It's a elective surgery. They call it healthy pet surgery.
Mm-hmm.
So between $150 to $200,
wow.
most veterinary clinics they can do it.
That's not bad.
And
at
there's
all.
a lot more options for that. Like even the Humane Society, a lot of those.
Humane Society.
I know there's one here, but in other states, I think every state has some kind of discount program, and it varies. There was one where we were in New York that the city did it. They did up to $1,000 a year in free spay neuters, and then there was another program through the Humane Society. You pay them like $45, and then they have a list of the vets that take the certificate,
Yep.
and then you only have to pay like another $20
So
or something.
much cheaper.
Like some of the vets they'll take that certificate, but then they want you to get vaccinated. Like they want something on top of it, which the cat needs anyway. So it's not like they're making you do something that you don't need that doesn't need to be done. So.
So don't be afraid to go to the doctor and ask, hey, I want to get my pet taken
or
care of. What are the programs
right,
that can help me?
right.
I don't have $200
Right.
or whatever.
And you can even call the local shelters, rescue, even some rescues could know. We used to, in New York, at the rescue that I volunteered for, we would always tell them the list. Some rescues have a list of all the clinics that you can go to.
This Chatty Cat podcast is sponsored by Milwaukee Walk-In Vet Clinic, home of the no hidden price policy.
There is no reason for the
No
pet
reason.
owners to go through this pain.
Yeah, I agree. Wow, that's huge. Did you hear that, World? Spay and neuter your animals. Who was the one actor, or not the actor, but
Bob Barker.
Yes, Bob Barker would always
used to
say at the end of his show. And remember, folks, always spay and neuter.
Yep.
Oh my God.
Question you should ask to the vet is, if I have a question, can I have access to your brain?
Right.
Can I ask you?
Do you think most of them will say yes just to make the sale?
Well, if they want your business, they will say yes. And then that's what I do.
Yeah.
I think the thing is that they're out there. You have to find them. I worked for a doctor years ago, and one of the hardest things was everybody wanted to talk to the doctor, and not everybody needed to talk to the doctor. So knowing that, I'll say, listen, don't make him call me back. Just when you have a second, ask him, and you can call me back with the information. I don't need to, take his time. So when you find that, who you can
Those types
talk
of doctors.
yeah, that's what you really, and unfortunately, that's what you really need to do. Like we joke, Stephanie, his office manager, jokes that I interviewed him when I first met him, but that's basically what you have to
There's
do.
a question you have to ask.
You have
Jen
to
asked
kind
me
of.
these questions. If I have questions, can I ask you? I said, sure. Absolutely.
Yeah.
And that's that was my learning curve. Cost me a lot of money to try to get, because I was always going to this vet and that vet and this one, and for years, not because I didn't know.
Yeah.
And so that's part of what I want to help with other people too, because when you start to hear the stories that people go through, and you really don't be afraid to, you're paying them. It's your money. It's your baby, your animal. We call them our babies, even. So you want the best for them. You would do it for your human, baby or spouse, whatever. So you want to do the same thing. But now I've come to realize that just because it's a good facility, like Dr. Singh said, even if it's it doesn't mean that that's your fit.
Yeah.
Don't be afraid to go out on a limb and, you know what, let me see, maybe that vet is actually better because they're not so busy. They're not like, they have the time to really want more one-on-one with you or whatever. So.
And the other thing is my personal experience this last week was, it irritated me, and it made me think twice on how I'm going to be moving forward with animals, because really, you take your pet who you think is probably dying right there, right then and now, and you're presented with the option of, well, we need to first kind of examine and find out what's going on. And so before you can even have any kind of relief, you're thrown a bill to say, make a deposit for all these things that we're going to do to find out what's wrong. And that deposit is outrageous and much, much more than just a doctor's visit.
And a lot of times it's not really necessary.
And
so I will like to inform the world that there is an insurance.
Oh yeah,
So when you have a pet, then research it. You can have insurance. That insurance might not cover your yearly vet visits like vaccinations, preventables, but it will cover serious diseases.
It actually would cover, because of the spay was wrong, that whole thing would have been covered.
Really?
The spay would not be covered, but the complications from it would have been covered.
And the treatments and so forth. So how do you...
basically what you are doing, you are paying roughly, I'm just picking up a number, $30 a month.
Okay.
So you're paying $400 a year.
Yep.
Okay. You paid in 7 years, 8 years, $2,800.
Yep.
And now your pet needs $5,000, $10,000 of surgery.
Yep.
That part will play, and you will not get hurt.
Wow.
At that time, you will say, "Okay, go ahead, do whatever you
Right.
feel like doing it. My dog should be saved."
And I have to say that's a pretty amazing, because all our cats are insured. And to walk in and be like, I don't even ask them for the bill. I said, just tell me what you want. I don't want to say, there's certain things I don't want them to do.
Yeah.
Like
Oh, that's not necessary,
I'll question,
this-
why are
yeah.
you going to do an
Yeah.
X-ray and an echo?
Yeah.
Just do the echo. It's like something like that. But I don't do it because I can't afford it. When my cat was sick with heart disease, he was having heart failure basically. Whatever they wanted to do, I said just do it. He has insurance. It doesn't matter. I don't have to worry about all that stuff. But a lot of people think it's a waste of money.
Well, because you're paying the monthly fee.
But the thing is that we do the same for ourselves.
Yeah.
How many times do you go to the doctor? You pay it every month.
Yeah, you're right.
You do the same thing. The thing is, the pet care has changed. When I was growing up, we never took any of our animals. We didn't have to. Unless it got hit by a car,
Yeah.
there was no reason to take your animal to a vet. I mean, rabies, and they had to have rabies.
Yep.
My dad took our cat. She was 19 when she died. He took her to get spayed and to get a rabies at the clinic. Never even saw a vet, like a real, you know, like a whole procedural, you know.
Yep.
And same thing with our dog. We used to. That's when I guess heart disease started because
heartworm.
we used to have to only give it 6 months, only half of the year, and that was the only thing the dog ever had. We never did anything for them. So that's all changed now because the environment has changed.
Yeah.
So years ago when they weren't getting all these weird diseases, it's not like that now. They are definitely, if you don't have a cat or a dog that has something, you're like the minority. You're like lucky if you have a cat or a dog that doesn't have anything. Right? They
Yes.
have a...
The main thing Jen changed is the emotional dependability. The people are now they are single units, like a husband, wife, a pet.
Okay. Yep.
So they are emotionally dependent upon the dog.
Yeah.
Because dog
that's
gives them
interesting, yeah.
emotionally
Yeah.
security, and they love the happiness.
So
they
protect
share.
your goddamn emotions.
Yes. So that is what you are paying for.
How does one go about researching? Just online? Just Google pet insurance?
Just Google pet insurance.
Maybe talk to
the vet.
Vet?
Every vet clinic has insurance posters and pamphlets, information. Absolutely. Research it, talk to the pet, talk to the insurance company, and be specific. And tell them, I need my insurance so that I need it when I really need it.
Yep. Until next time, world. Episode 3 coming soon. Email,
Spay and neuter.
Spay and neuter.
Spay and neuter.
And email with any questions for future podcasts.